Hi students, it's Dr. Ways and welcome to your lecture on the cranial nerves. Alright, so there are 12 cranial nerves numbered 1 through 12, starting with the front and going all the way to the back of the brain on the inferior side. And typically they're numbered in Roman numerals. So cranial 1, cranial nerve 2, cranial nerve 3. And that's the nomenclature that I'm going to use. So make sure you are familiar with Roman numerals and the numbering system. All right, so just as a general overview, and this is the only time that I'm going to write them in non-Roman numerals, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And notice that the 12th cranial nerve is on either side of the pyramids of the medulla oblongata, as opposed to the anterior side of the medulla. So your job is not only to be able to recognize them, but know what their common name is. For example, the olfactory bulbs are part of the olfactory nerve, which is a cranial nerve 1, as well as the general function of the cranial nerves and whether it's sensory or motor. All right, so this is a picture showing you the cranial nerves as they are going through the various foramina within the skull. So go back to that lecture on the bones of the skull and review the foramina, because that's going to really help you with how the cranial nerves fit through those foramina here. So this will be another one of those good review slides where it shows you all the cranial nerves, starting with 1 right here. And it looks like they've got the first 6 on the left side and the last 6 on the right side. So what it shows you is the name, the number, of course where it's located, looking at the brain here, and whether they're afferent or efferent fibers. So now is a good time to remind yourself what afferent means. Afferent refers to sensory, so that tells you that it's anything in blue is going to be a sensory function, and anything in red is going to be a motor function. So the way this is typically done when we talk about sensory or motor, label them as sensory, motor, or some of them are both. And we'll point all of that out along the way as we're going through each one. All right, cranial nerve 1 is the olfactory nerve, and the olfactory nerve is attached to the olfactory bulbs, which are at the most anterior part of the brain. And remember, they sit within the cribriform plates on either side of the crista galli of the ethmoid bone. And being olfactory, their primary function is smell, and we know that smell is a sense, so those would be afferent neurons. Within the olfactory bulb here, there is this network of fibers that are interacting with each other. We're not going to go through all of the details of this, but notice that they ultimately connect to these basal cells, and these basal cells go through the cribriform plate right here and send little appendages out within the mucosa of the nasal cavity. And they have receptors on them that are going to pick up different chemicals that are in the air that get wafted into your nasal cavity, and that gets interpreted through this network and in the brain as different types of smell. So how do you test if this function is intact? Have the patient close their eyes, close one nostril, and put something like coffee underneath their nostril. And if they can identify it as coffee, then their cranial nerve 1 is intact. All right, cranial nerve 2 comes out of this optic chiasma right here, and remember that's the structure that's just anterior to the infundibulum of the pituitary gland and the mammillary bodies. And it's going to come out of the optic canal right here. So that's going to be cranial nerve 2, the optic nerve. And we have several cranial nerves that are involved in the eye. This particular one is involved in vision, so that's strictly going to be sensory function. So of course, how do you test this one? How to test if it's intact? Have somebody read an eye chart, and that will tell, or be able to identify objects in a room. That will tell you if they are able to actually see, which is a function of this cranial nerve. The way the optic nerve is set up is you have all of these retina. You have the retina right here. Actually, this whole thing is the retina. And you have this series of cells that, and this is transparent, so light's passing through, ends up hitting these rods and cone cells right here. That information is then transmitted up this way, down the tracks and into the optic nerve right here. And the way this works is anything on your left field of vision go to the left nasal side of the left eye and the temporal side of the right eye to give you your left field of vision. And anything that is in the right field of vision is going to go to the temporal side of the right eye and the nasal side of the left eye. All right, those tracks, we'll stick with the left side here since that's what's drawn out. That which is coming into the left eye goes through the optic nerve, through the optic chiasma, crosses over, and then synapses within the lateral geniculate nucleus, which is part of the thalamus. And then that coming from the right eye is going to travel down the optic nerve, but it's going to stay on the right side, synapse within the thalamus, and then that information is then going to be directed to the right hemisphere of the brain. And a similar thing is going to happen for your right field of vision, where the left eye will stay on the same side, but the information from the right eye will cross over the optic chiasma and be interpreted on the left side of the brain. And then the job of the occipital lobe is to put these images together and arrange them to a picture that you can actually see, which creates vision. All right, cranial nerves 3, 4, and 6. So we're skipping around a little bit, and the reason why we're skipping around is because 3, 4, and 6 all have similar function. 3 is the oculomotor, 4 is the trochlear, and 5 is the abducens nerve. And all of them are motor and are involved in eye movement. All right. Specifically, the ocular motor is involved in intrinsic eye movement, which is movement of the actual eyeball, as well as extrinsic eye movement, which is movement of your eyelid, for example. The trochlear nerve is only responsible for extrinsic eye movement, one particular movement, and the abducens nerve is only responsible for one particular extrinsic eye movement as well, abducting the eyeball. All right, so this slide we're going to start by talking about cranial nerve 4 and 6 because those are the weird ones. So cranial nerve 4 is known as the trochlear muscle, and right here you see within the orbit this structure called the trochlea, which if you remember from the humerus means pulley. And so the superior oblique muscle is attached to this trochlea, or goes through this trochlea, and then attaches to the eyeball over on the opposite side. So when the cranial nerve 4 stimulates this muscle to contract, it's going to pull the eyeball in this direction, so down and lateral, what we call abduction and depression. Cranial nerve 6 is known as the abducens nerve, and the only muscle it controls is the lateral rectus right here. Lateral rectus means it's on the lateral side of the eyeball, and so when it contracts, it's going to abduct the eye. So your cranial nerve 4 and 6 take the eyeball in a depressed and abduction direction. All of the rest of the intrinsic muscles of the eye are controlled by cranial nerve 3, which is the oculomotor nerve. So all of these other ones right here are controlled by the oculomotor nerve. Image A right here basically shows you if you were to contract certain muscles, what direction your eyeball would move. Figure B down here shows that if you want to test the function of a particular eye muscle, this is the direction you need to look. All right, so if you want to test the function of the superior rectus, you would look in a medial and upward or elevated direction, and so on. All right, so whether we're talking about figure A or figure B, one of the things you should be familiar with are the 6 cardinal fields of gaze. And so those 6 cardinal fields of gaze are adduction, abduction, elevation with adduction, depression with adduction, elevation with abduction, and depression with abduction. So if you test those 6 cardinal fields of gaze, what you're doing is essentially testing all of the cranial nerves as well as the intrinsic muscles of the eye. And just to point out where these are specifically, here would be cranial nerve 3, the ocular motor. So notice it's just behind or just posterior to the optic nerve. Cranial nerve 4, which is right here, just in front of the trigeminal, and cranial nerve 6, which is coming out of here, out of the border between the medulla oblongata and the pons, and that would be your abducens nerve. All right, remember we did cranial nerve 3, oculomotor, cranial nerve 4, trochlear, and cranial nerve 6, the abducens nerve. So we skipped over cranial nerve 5. So now we're going to go back and hit cranial nerve 5, and that is the trigeminal nerve. Easy to recognize on the brain because it is this gigantic nerve that is coming out between cranial nerves, actually 4 and 6, obviously. And it has 3 branches to it. All right, so it's going to have 3 branches to it, trigeminal. All right, those, the function, notice it says both, so sensory and motor. So the sensations in the head, and we'll talk about those, as well as the muscles of mastication. So the divisions are going to be V1, the ophthalmic nerve, and that's going to come out of the superior orbital fissure. And we saw that superior orbital fissure when we talked about the cranial nerves 3, 4, and 6. V2, which is the maxillary division or maxillary nerve, that's going to come out of the foramen rotundum. All right, so go back and review where that is on your bones of the skull. And V3, which is the mandibular nerve. So that's going to come out of the foramen ovale. So again, go back and review where that is. So ophthalmic, maxillary, and mandibular. So the names of the nerves, the branches, actually tell you where the nerve is going to. So we'll use that to our advantage in the next slide to talk about function. Oh, so see how nice I am? I made this, put this right in for you for convenience sake. So here would be the foramen rotundum, where the maxillary division of the trigeminal nerve is going through. Here would be the superior orbital fissure under the lesser wing of the sphenoid. And here is the foramen ovale, all right, so that oval hole through which the mandibular vision is going through, or mandibular division, mandibular nerve is going through. All right, and this picture down here is just showing you where the different divisions of the trochlear nerve are coming through. So here is the one branch coming out of the superior orbital fissure here, and the exit holes for the other 2 branches are not shown here. So here's our ophthalmic division right here coming out of the superior orbital fissure, and know it's branching to the frontal bone as well as to the or the frontal area as well as to the parietal area. and it is going to supply sensory innervation to those areas. Remember, we already talked about the trigeminal nerve supplying sensory innervation to the scalp in this area, but now we see the other branches and where it's going to go to. And I'm not going to cover all of where the specifics of it here. The second branch, which would be the mandibular nerve, is that orange one that's coming out here. And that is also going to supply strictly sensory to the areas that you see where it's going here. And the third branch, V3, is going to be the blue one here. That's going to supply innervation to sensory innervation to the areas that you see, as well as motor innervation to muscles involved in chewing, and that includes the temporalis, masseter, the pterygoid muscles, as well as a few other smaller muscles as well. How do we test the trigeminal nerve? Well, we do that sharp, soft touch in areas of the scalp, on the maxillary region, on the mandible, as well as strength tests for opening the jaw, opening the mouth. Cranial nerve 7, the facial nerve. Notice that it has both functions, sensory and motor. So it is going to be involved in the muscles of facial expression, which is the last lecture that we're going to do for this class, as well as taste on the anterior 2/3 of the tongue. So only the anterior 2/3 of the tongue. Its exit is going to be through the internal acoustic meatus, or internal auditory meatus. So on the brain, here is the facial nerve right here. All right, so just for showing how this works, here is the internal acoustic meatus right here. So you would have several nerves going through there, including the facial nerve. Notice also the vestibulocochlear nerve goes through there. But the vestibulocochlear nerve is attached to structures of the inner ear, whereas the facial nerve, notice over here that it's coming out from just inferior to the external acoustic meatus. So it's not actually part of the canal, it comes out under the canal and then goes to the facial muscles it needs to go to. So it's going to come out under the ear and then go to all levels of the face, all right, to the muscles of facial expression. How do we test this cranial nerve? Look for facial symmetry. Have a patient smile, raise their eyebrows, close their eyes, whistle, puff their cheeks, things like that. In order to test the sensory function, have them taste sweet or salty on the anterior 2/3 of the tongue. All right, next we have the vestibulocochlear nerve right here, cranial nerve 8. That is strictly sensory, and notice that it has two names to it. Vestibulo, which is going to be referring to balance or equilibrium, and the cochlear part, which is referring to hearing, our ability to hear. All right, so it's strictly sensory, hearing and equilibrium, and the cranial exit is the internal acoustic meatus, and of course we know it goes into the internal acoustic meatus, but it is attached to the sensory organs that are within the bone of the petrous part of the temporal bone. All right, how do we test the vestibular part? Well, we can have our patient stand on one leg for balance, and we could whisper into the patient, behind the patient, and see if they hear what we're whispering, or if they hear a watch ticking, really small sounds, or barely audible sounds. Then we could also do tests such as the Rene test and the Weber test, and those are using a tuning fork. We're not going to discuss that now. You'll do that in your physical exam lab. All right, just again showing you the internal acoustic meatus, where both the facial nerve as well as the vestibulocochlear nerve will go. Facial nerve is going to come out just inferior to the external acoustic meatus, but the vestibulocochlear nerve is going to go to the apparati for hearing and equilibrium that are within this petrous part of the um, temporal bone. And so here's the nerve going to the semicircular canals, which are going to be involved in equilibrium, and to the cochlea, which is going to be involved in hearing on both sides. So, of course, these are connected to our middle ear and where the three bones are. We'll talk about when we get to the ear, and to the external ear, and strictly involved in hearing. So the direction of this is going to be, of course, in this direction, even though we're talking about it coming out of the brain. All right, cranial nerve 9 is the glossopharyngeal nerve right here. All right, glossopharyngeal. So the name tells you kind of what it is about. Glosso refers to tongue, pharyngeal refers to the pharynx. So your tongue and your pharynx allow you to do what? Swallow. So it has both sensory and motor function. Of course, the muscles of the pharynx would allow you to do the swallowing aspect, but it also provides a sensory function of taste on the posterior 1/3 of the tongue. So remember, the facial nerve provides taste for the anterior 2/3 of the tongue, and the glossopharyngeal nerve provides taste for the posterior 1/3 of the tongue. So that's the glossal part, and the pharyngeal part would be the muscles of the pharynx. How do we test this if this is intact? We could have the patient taste sour and bitter on the posterior third of the tongue. We could have the patient say ah and elevate their uvula and palate to see if that's intact. The gag response is always a good one, and being able to swallow a cup of water would be another way to test the cranial nerve 9. All right, cranial nerve 9 goes out the jugular foramen, and so that is this hole right here on the posterior portion of the petrous part of the temporal bone. So the jugular foramen, of course, the jugular vein would also go through that as well. So here you see it, here's the jugular vein, and then here is the glossopharyngeal nerve coming out. And we've seen this picture before when we were talking about the neck. Cranial nerve 10, the vagus nerve. All right, we've talked about the vagus nerve several times, and we've seen the distal end of it and the different parts that it's going to. The vagus nerve is also going to come out of the jugular foramen. So the cranial nerve 9 and cranial nerve 10. Where is it here? Here's cranial nerve 10, the jugular nerve, is also going to come out of the jugular foramen. Vagus nerve coming out of the jugular foramen. It has both sensory and motor function. Notice it's parasympathetic, so we always associate the vagus nerve with parasympathetic to major viscera. All right, parasympathetic innervation to major viscera. So that's going to be both sensory and motor. And then the larynx and pharynx muscles that are going to be involved in swallowing and speech. How do we test the vagus nerve? We tested it along with cranial nerve 9 when we did the saying ah, the gag response, swallowing. Those all test both cranial nerve 9 and cranial nerve 10. All right, just for clarity, here is the vagus nerve coming out of the jugular foramen. The glossopharyngeal nerve, cranial nerve 9, would come out just anterior to that here. So here would be the jugular foramen. Notice it going down to muscles of the larynx and the pharynx, and then it's going to continue down through the thoracic cavity into the abdominal cavity to innervate major viscera along the way. So here is another part of it. You see the right vagus nerve as well as the left vagus nerve going down the sides of the neck and over the major blood vessels coming out of the heart. All right, cranial nerve 11 is the accessory nerve or spinal accessory nerve because you see it being attached to the spinal cord here. And it's the only one that has multiple roots that you can see going into the spinal cord. It is going to be motor specifically, and it's going to innervate the trapezius, which we've already seen, as well as the sternocleidomastoid muscles, which we've already seen. And again, this one's going to exit out of the jugular foramen, which again to point out is right here. So cranial nerve 9, 10, and 11 all exit from the jugular foramen, as well as the jugular vein. So that tells you that's a pretty big hole when you're going to find it. And notice that it's just lateral to the foramen magnum on the anterior side. All right, so here's our accessory nerve coming out right here. And it's got one branch, and it's going to be joined by other branches as well. And it's going to the trapezius muscle and to the sternocleidomastoid muscle, causing those to contract. And remember, the trapezius muscle is involved in shoulder movements, and the sternocleidomastoid is involved in head movements as well as an accessory muscle for breathing. So to test if these are working properly, have your patient shrug their shoulders and then shrug against resistance. Have them turn their head to one side and against resistance, and then to the other side and as well as against resistance, and that will test the function of cranial nerve 11. And finally, cranial nerve 12, that is out of the plane of the rest of the cranial nerve, so it's sitting on either side of the pyramids of the medulla oblongata, as opposed to on the anterior lateral side of the medulla oblongata, or anterior to it in general. So the hypoglossal nerve, that name also tells you kind of what the function does. Hypo below, glossal the tongue. So it's going to be involved in controlling tongue movements. It is strictly motor, goes to the tongue muscles, and it exits out of the hypoglossal canal. And you notice that the hypoglossal canal are two little canals that are on either side of the actual foramen magnum. So if you look at the foramen magnum and there are two smaller holes within the border of the foramen magnum, that's the hypoglossal canal through which the hypoglossal nerve goes. So here you see the exit coming out, and it's going to go down, and here is it going to the muscles of the tongue, the various muscles of the tongue branching out, including the ones that are under the tongue, which include our genioglossus, geniohyoid, and so on. So the function with tongue movement is, of course, going to be speech. It's going to be swallowing, moving food around in their mouth. To test it, have your patient say sounds that involve the tongue, like L's and T's and D's and N's, and words that are associated with that, as well as inspecting the tongue. Have them stick it out if it comes out at midline, if it's moving properly, hold their tongue and have them move it against resistance, and that'll tell you the function of cranial nerve 12.